You might be thinking that this is acne around the mouth, but this is actually a condition known as perioral dermatitis. So let's talk about the difference between this condition and true acne. Perioral dermatitis is an inflammatory condition that presents with clusters of red, inflamed bumps and tiny pustules around the mouth and around the nose, and often affects women between the ages of 18 and 40. Perioral dermatitis is often triggered by the use of topical steroids, toothpaste that contain fluoride or cinnamon, and certain cosmetic products can trigger this. Although perioral dermatitis may look like acne, there's actually no presence of comedones, which are whiteheads and blackheads. And another characteristic feature of this rash is that it typically spares the immediate lip margin. We may also see it affect areas such as around the nose and the lateral or lower eyelids. And in that case, we refer to it as periorificial dermatitis. Acne can look similar to perioral dermatitis, especially during hormonal flares when we see it more often on the chin and the jawline in women, but there is a presence of comedones, again, whiteheads and blackheads, along with inflammatory nodules and cysts. True acne affects both men and women equally, whereas perioral dermatitis is more common in women. And in acne, we tend to see it start in puberty when androgen hormones activate and start to stimulate the oil glands. But of course, it can happen in adults too. For those who have perioral dermatitis caused by chronic topical steroid use, it's important to slowly discontinue the topical steroid in an appropriate taper, as suddenly stopping the steroid can actually lead to a rebound and a flare of the rash. We may also start to implement some other anti-inflammatory topicals for perioral dermatitis, such as pimecrolimus. Now, some of our treatments for acne actually overlap with perioral dermatitis. So those medications would include like oral doxycycline or some topical antibiotics, such as topical clindamycin. But it's very important to know that for those who have actual perioral dermatitis, topical retinoids or salicylic acid, which are treatments for acne, can actually make the condition worse.